morning, everyone. Thank you so much for joining us tonight for this very important town hall on COVID vaccinations. And we have wonderful special guests. I'm Cook County Commissioner Donna Miller, and I would like to take a moment to introduce Cook County Board President Tony Preckwinkle, who will give us a brief introduction.
Hello, this is Tony Preckwinkle, President of the Cook County Board of Commissioners. I'm here today to thank you for coming out to our Take Your Shot virtual event. We all know that these days can be stressful, and now that the vaccine is here, we're all wondering about what comes next. Not to worry, you've come to the right place. Today you'll be provided a space to ask questions and hear from our Cook County medical experts about next steps in the vaccination program. We can see the light at the end of the tunnel, and I applaud you for coming out to learn more. Thank you.
Thank you so much, Madam President. And I just wanted to get into our program tonight. It's called Take Your Shot, and we are here to answer your questions about what's going on with the vaccination. And I'd like to introduce briefly our speakers and also let you know if you have any questions, please call 312-738 with questions, and we will get to all of these questions as the night progresses. So first, I'd like to introduce Dr. Rachel Rubin, who is the co-lead for Cook County Department of Health. Second, we have Dr. Gwendolyn Oglesby-Odom, who is the Chief Nursing Officer at Advocate Trinity Hospital. And then we also have Dr. Ellen Mason, who is an internist at John Stroger Hospital. We're also going to hear from Christina Vanko, who was a Moderna trial vaccine recipient last fall. So I would like to just get us started with after these introductions and have Dr. Rubin begin the program this evening.
Thank you so much. I am going to try to share my screen. If it doesn't work, that's okay. I'm going to talk for just a few brief moments, but I thought the slides might be helpful. So give me one quick second. Okay. Here we go. So this is going to be a brief introduction about the COVID-19 vaccine and giving you a little glimpse about the breadth of our plan for the Cook County Department of Public Health and the Cook County Health System. And as a preamble, to understand that my health department covers suburban Cook County. So I won't be talking about initiatives in the city, but the city has very similar kinds of programs that might be operationalized a little bit differently, but we are all doing very similar outreach to, to communities and mobilizing in our areas of most underserved population. So to start off, the two vaccines that we have right now are the Pfizer and the Moderna vaccine. They are both using the same technology in terms of developing them, and it's called an mRNA or an RNA vaccine. So it's not live vaccine. Nobody is getting injected with the virus itself. And the Pfizer vaccine, you have dose 1, and then the second dose is 21 days, 3 weeks later, and the Moderna is 4 weeks later. So you can't mix and match them. So if you get the Pfizer for your first shot, you should get that for your second, and the same with the Moderna. And they've both been shown to be very safe and effective. And the idea is obviously to build the body's immunity up to the virus that causes COVID-19. However, we have to be careful because those that are vaccinated may still contract the virus and possibly pass it on without them even knowing it. Because if you get the virus when you've had the vaccine, evidence has shown so far that if you do get the virus when you have the vaccine, that you get it very mildly or asymptomatically. So in terms of our vaccine strategy overall for the Department of Public Health, partnerships are key to achieving the goal of 70 to 80% vaccine coverage in order to get what we call herd immunity. Herd immunity meaning that enough people in the population are vaccinated that the virus itself is not circulating in the community at a very high level, such that even if you're not immune because you did not have a vaccine, that you are not going to be encountering the virus in the contagious environment. And so then you will not get sick. So the idea is to get healthcare providers in the community to immunize along with some mass mass vaccination events that we're doing, but we really need to get as many community partners, of healthcare providers, anything from physicians to dentists to pharmacists that work in a variety of pharmacy settings to help us in this joint project of getting as much vaccine into people as quickly as possible in a safe and equitable fashion. So the idea of Cook County Health with our health department, we're jointly coordinating and immunizing critical populations and identifying and bridging those gaps in coverage, while our partners will be working to do the bulk of the vaccinations on a community level, including the max vaccination sites where we're actually using personnel from the National Guard. So one thing that people have been asking a lot of questions about are the phases. And so they're basically two phases. At one point, there were 3 or 4, according to CDC guidance, but there's actually 2 phases. But phase 1 has been split into 3 tiers. And right now we are in tier 1A. And that includes the hospital-based healthcare workers who are at the highest risk of exposure. So those that work directly with COVID patients, working in intensive care units, medical floors with COVID patients in emergency rooms, and then going out in concentric circles, like for individuals like myself, where I just see outpatients. And then going far out beyond that, and they are still in phase 1A, all medical workers such as dentists and physical therapists and speech therapists, and obviously, home health nurses and home health aides, and all community-based health workers. And that also includes emergency medical services, so our EMTs and paramedics. And that's what phase 1A is. So starting on Monday, we're moving into phase 1B. And phase 1B includes 2 of the biggest groups. There's frontline essential workers, not all of them, but the majority of them. And there's a whole list of them that I won't go through tonight, but you can get them all online from the CDC or from our website or from the state's website. Cook County publichealth.org or IDPH COVID is what you can search. And also the second group is individuals over 65 years old. And to get some perspective, in suburban Cook County, there were about 370,000 individuals that we know of that are above the ages of 65. And we have about 275 or so thousand individuals that are frontline essential workers in the phase 1B category. So those frontline workers, as we say here, are those that are considered essential to the functioning of society and are at substantially higher risk of exposure. So it's not somebody that's teleworking from home, even though they may be doing a very essential and critical job, but it is the grocery store employee. It's the person working at the UPS package store, our postal workers, okay, our transportation workers. And then we move into phase 1C. And phase 1B, we imagine, is going to probably take at least 2 months or maybe more, because it's such a huge population. It's almost 1 million people, 750,000 people in suburban Cook alone. You double that, including the city of Chicago, and then you just multiply that going out. So that is hundreds of millions of people. And then there's phase 1C, which are individuals from the ages of 16 to 64 that have high risk conditions, so underlying heart disease or lung disease or type 2 diabetes, and the essential workers that aren't covered in the phase 1B. And then finally, we get to phase 2, which we hope to get to by this summer and hopefully sooner. And that will be all people above age 16 and that aren't fitting into any of the other categories. And this doesn't yet include children, because we are waiting for more data to come in from studies that have been able to look at children. We don't know yet about the safety in children and also the effectiveness. So we imagine that it will be safe and effective in that population as well. Oh, one other thing I forgot to mention, phase 1B coming up are school teachers from preschool up through 12th grade. So that's great news for our highly essential teachers and workers in schools. So the vaccine access points through our partnerships include our federal pharmacy program, and this is direct from the feds. They send out vaccine to Walgreens and CVS, and they have been vaccinating our older and infirm family and friends and residents who live in long-term care facilities such as nursing homes and assisted living facilities. And in addition, hospitals have been pushing out vaccine, and they have pretty much completed vaccine to their own employees, at least the first dose, and they're beginning to do and completing that second dose of their own employees. And they have been working to reach out now to community healthcare workers that are not affiliated with big medical centers to get them on board as well, like the home healthcare workers and the dentists as two groups amongst many. And then we are also working with pharmacies. We have on board so far Jewel Osco, Walgreens, and Mariano's providing vaccine for phase 1A, and they will also begin to roll into phase 1B next week. But we're still going to be prioritizing 1A as long as there are 1A folks out there to be vaccinated. So that doesn't mean when we go into 1B that the 1A are put at the back of the line. They are still at the front of the line. And also working with community healthcare providers such as federally qualified health centers. And we are highlighting Oak Street Health because we had a media event with them yesterday, and they've been a tremendous partner. They have 4 centers in our jurisdiction within suburban Cook, and they have several others. They have at least as many, if not more, centers within the city of Chicago and a couple of other suburbs that have their own health departments. And we are also planning to work on a hyper-local level to get frontline essential workers such as school and EMS personnel. And under 1B, that also includes emergency responders such as firefighters and police. Okay, I'm finishing up here. So these are the access points that are managed by us at Cook County, and that includes our ambulatory and community health network. There are 13 locations throughout Cook County in the city, as well as the suburbs. There are 6 sites in the suburbs that are part of this, and the rest of the city that are going to be ramping up vaccines. Some have already started this week. And we are providing the suburban sites with vaccine, and the city Department of Public Health is providing the city locations. And these are open to community members, not just those individuals that are patients enrolled in those clinics. And we are going to plan on large vaccination sites, and this will be officially announced later this week, but these are some of the sites that we're looking at to do more, as we're calling, megapods or mega sites for vaccination that will be supported with the National Guard, providing medics and support personnel working alongside Cook County Health and Cook County Department of Public Health personnel. We are planning, especially once it warms up, to possibly set up some drive-through sites using our relationship with the Forest Preserve District of Cook County. And also mobile vaccinations, in that we want to plan to provide mobile vaccine to specific populations or communities that don't have access to a Walgreens or to a Mariano's or to a large medical center in their neighborhood that can do vaccine. And also we're going to be setting up some strike teams, and all of these drive-through mobile vaccine strike teams are coming in the future. Some will be ramped up in February, and others will be waiting until the weather is more conducive, right? And so this is the big thing, is that on Thursday, we hope Thursday, maybe Friday, is that we are ramping up a new website that will allow people to express their interest online for the vaccine, regardless of what phase you're in. We're in phase 1A, but we're going to phase 1B shortly, and then eventually 1C and 2. And we want to know people who are willing to have the vaccine, and we will then be pushing out messaging to them of when their time in line has come up, and then they will be pushed out links so that they can set up appointments to go to either one of the mega sites or one of our partners at either a clinical site or a pharmacy. We already have a system that does this on our current website, but this is going to be much more robust because it will be rolling in the mega site registration and appointment system into it once those things are up and running. So in summary, the Pfizer and Moderna vaccines are safe and effective. Every eligible person should get vaccinated. We are starting into phase 1B as of next Monday. So that's very exciting. And that means that we have gone through the majority of 1A already, and we are going to continue doing them as long as necessary also. And vaccine is always going to be administered by approved vaccine providers approved by the state. and a variety of sites in suburban Cook, including the things that I had mentioned earlier, are all part of that. And our new, as we're calling it, our microsite will be going live Thursday or Friday for signing up for expressing interest in the vaccine. We also have a hotline where you can call with your questions about vaccine in general, or about COVID overall, about contact tracing, about testing, just wanting more knowledge about the virus. And we are there to help you during the week. We have a hotline, and there also is an email address on our website. So thank you. And those are the end of my remarks, and I will stop sharing my screen.
Thank you so much, Dr. Rubin. It looks like we're getting information hot off the press here for all the interesting and new rollouts of the vaccines. We know there's been a lot of preconceptions and misconceptions about the vaccines and how the rollout will function. So that explanation really clears up a lot of that. And I think it's important that we have these platforms to address the concerns of our residents. We will be taking questions shortly, but we just wanted to get through everyone's presentation, and then we'll have some questions near the end, okay? So next we will have Dr. Odom, who is the Chief Nursing Officer at Trinity, Advocate Trinity Hospital. And just speak to us now, Dr. Odom, about the nursing aspect of the vaccination process as well as treatment.
We're going to talk a little bit about the importance of vaccinating the hospital staff, too, Donna. Hospital staff are healthcare warriors, and they stare COVID in the face every day, and they are dedicated to this war against this pandemic. This mere fact puts them at increased risk for contracting COVID. We need our healthcare warriors to stay healthy so that they can stay on the front line in this battle, and we can't win this fight without those healthcare workers. So it's very important. A nurse's role is very important in the role to eradicate this disease.
Thank you so much, Dr. Odom. I appreciate that. So next we're going to go on to Dr. Ellen Mason, who's an internist at Stroger, and would appreciate just hearing some brief comments from you as well before we get to our questions.
Well, first, I have to thank you for inviting me. This is very exciting. It's interesting to present information about the virus and its illness and its effect on people at the end and have the vaccine at the beginning. So we really are talking about more than light at the end of the tunnel. We're going through the tunnel very fast. I think a point that's really important to remember about COVID is it's so variable. And another point that's really important to remember is that the vast majority of people who catch it do fine. More than 80% of people who get it are not terribly sick. And we're hearing a lot about people who are sick because for an infectious disease, it's very infectious. I think except for measles, which I'm old enough to remember when there wasn't a measles vaccine, it's about one of the most infectious diseases you're going to run into. So we're still worrying a lot about the people who have increased risk. We're worrying about people who have certain conditions that really put them at a higher risk of being very sick, of being in the hospital, of getting into intensive care, and being on a ventilator, which I think at this point most people have sort of heard is a very sort of ultimate experience for a human being to go through. So not everybody who has a chronic condition is at risk for being very, very sick. So that's kind of one of the really surprising things about why doesn't it hurt everybody who has a chronic disease? So if you have cancer, supposedly you're at risk, but really current cancer that's being treated now, not like I had, a thing removed 5 years ago. No, you're not at more risk. If you have emphysema or lung and many kinds of lung disease, you're at more risk for getting sick. But here's the flip side. We don't really see much worse cases in folks with asthma. We don't really see much worse cases in people with a bad condition that affects the lungs called cystic fibrosis. So where's the justice? How is this fair? Why are some people getting so sick and some people not? A couple other categories that I thought I would mention in terms of increased risk for people with serious heart disease. So things like congestive heart failure, bad blockages in your coronary blood vessels, and diseases that affect the actual pumping function of the heart called cardiomyopathies. We also know, and this is an area of great interest of mine, that women who are pregnant, even though they do well, they are younger, they do have a higher risk of being very sick. We saw that with the influenza pandemic 100 years ago. For some reason, there's a change in the immune system of pregnant women that makes them more vulnerable. To tolerate a fetus, you have to give something up, and some of that is disease-fighting capabilities. And lastly, and I'll mention these because they're common and important, people who smoke cigarettes. So, I guess if you had to have another reason to quit, this would be a time to quit, quit, quit. If you need nicotine replacement therapy, if you need support and assistance, any of us in the community, any primary care providers, we have a smoking quit line, we have a state quit line, you can get help very easily. And type 2 diabetes, I want to mention, and obesity. Now, type 2 diabetes, you can't do anything about, but you should be aware of your increased risk. And obesity, well, it's not like smoking where I can say, change that right now. But again, taking your symptoms seriously. If you do have symptoms, staying in touch with your provider and knowing when you should actually seek help in a hospital or an emergency room. So those are things to think about. I think one last thing I want to talk about before we go to all these amazingly fascinating questions I'm seeing in the chat box, is just the importance of maintaining your health during this pandemic, taking your medications, making sure you stay in touch with your providers so you don't have a interruption. You can get your medicines. A lot of pharmacies started delivering. I'm amazed. Pharmacies in places that I would never thought deliver are delivering. And making sure that if you're getting crucial therapies, you go for them. So maybe you might delay a voluntary sort of cancer screening procedure a little bit, but you're not going to delay your chemotherapy. You're not going to delay your radiation therapy. You shouldn't do that. And people need to know, because actually, as of right now, in this morning's New York Times, which is often the medical journal for a lot of us, we're seeing a lot of excess deaths apart from the number of people who've died in this country from COVID. So we know that on some level, people are not necessarily seeking healthcare when they need to. People are foregoing healthcare, and we need people to have confidence that we are trying in our hospitals, in our clinics, in all our sites, in dental offices, to maintain a very safe environment for you to get that needed care if you're in a category where you should be coming regular. All right. So with that, I think I'll turn it back over to our wonderful moderator.
Thank you so much, Dr. Mason. All of those are great points. So we do have many questions. We want to make sure we're answering your questions so you can understand why it's important to take your shot. So let's go to the first question that we have.
Hi. Happy Tuesday. Thanks for putting this on.
Our pleasure.
I have a couple of questions. I just turned 65, and I wanted to see, what the cost of the vaccine is going to be, B, why some of the suburbs have had signups already, and C, which vaccine is it going to be? Is it going to be the Pfizer or Moderna vaccine? And D, what is the site I should go to sign up? I'll hang up and listen. Thank you.
Thanks. I think Dr. Rubin, do you want to take that one?
Sure. Let me see if I can remember all the components. First of all, if you are 65 or older, as of Monday, you will qualify to get the vaccine. Our new sort of interest page is going to be online Thursday or Friday. The thing to do is to go to our website. I put it in the chat box, and then you will be able to get that link once it's up. We do have an old link there now, and you can go on to that if you want, because the information on the old link, the old site, will push into the new one. But I think it might be good just wait a couple of days to sign up. There is no cost to you for anything. If you have insurance, we will be asking insurance information, because the administrative cost of doing the vaccine, so the cost for the nurse that puts the needle in your arm, for the equipment that we have to buy that doesn't necessarily come with the vaccine, the personal protective equipment, the facility charges, insurance companies will cover that and pay for it, but you will not have any copays, any deductibles. The individual will not see a bill. The vaccine itself is free, coming from the federal government. So we do need insurance information if you have insurance, either public insurance or private insurance, because then we can recoup some costs. Excuse me. But it is not going to cost the individual anything. So that's terrific. I've heard that there are some pharmacies that have been putting up signs about vaccine, and I think it's been mainly in preparation for 1B rolling out next week. We also don't want to have any wastage. So there have been, in some areas of the state, where they have gone through their 1A population They don't want when they've opened up vaccine, because when you open up a tray of vaccine and it's been in this hyper frozen state and you thaw it out, you have to use it within so many hours. You can keep it in the refrigerator for a few days, but once it's thawed out at room temperature, you have to use it within a few hours. So we don't want even one dose to go to waste. So if some people don't show up for their appointments, a clinic may call some of their older folks that live down the block and say, please come in, we have some vaccine, we don't want it to go to waste. So that's possible that might be where you're hearing, as well as in those areas of the state where they've been able to do that. To understand, suburban Cook County actually has a disproportionate number of healthcare workers, so those that are in 1A population. So we haven't gotten through them all yet. And we anticipate we're going to still be needing to get those 1A folks to accept the vaccine, to understand it's safe and it's free, and we really want to vaccinate you. But we need to be prioritizing 1A, and then we're going to 1B. And we understand that there are some 1B people that have already gotten the vaccine, but that's not our guidance or our rules. And let me see, was there anything else in that multi-part question? If I missed anything, just let me know.
I think you covered it all, so thank you. And this is just an excellent example of how multifaceted the questions can be, even from one person. So we have another person on the line who's going to ask a question. Go ahead. Hi.
Yeah, my name's Chuck. And so my question is in regards to vaccine safety. It obviously they're calling this warp speed for a reason. And recently I've been reading about people who are dying from vaccines or have had injuries. And I'm hearing from the drug companies that it's just a coincidence. And given that the drug companies have so much money involved and that they have no legal liability even for gross negligence, and how can I be assured that what they're doing is safe?
Well, thank you for that question. I think Dr. Mason and Dr. Rubin can both answer the question about the safety and efficacy of the vaccine. Do either one of you want to go first?
I'll say a few words. I mean, I consider Rachel the titan of public health and a fountain of knowledge. I'm sorry, Dr. Rubin. But I do want to say a couple of things that I think people really need to be aware of. These vaccines have been well tested. They've been tested on thousands and thousands of people. The timeline for getting a vaccine out in a year is unprecedented. Usually it takes 15 to 20 years, but that's because there is no great incentive to get it out. And also there isn't a public health emergency. You don't have 300,000 people dying. I think it's very, very logical and a good question to say, is there a vested interest? Is this really safe? This vaccine safety is being tracked in a more intensive way than other vaccines are. And all vaccine safety is tracked very carefully. Okay. And so when I got my second injection this morning, I got my QRS code scanned into my phone, and the CDC, the Center for Disease Control, is calling me every day and sent me a text today to ask me how I felt. So to address for 1 second that issue about, well, is this coincidence? I think a couple days ago, there was a news item about Norwegian, very frail, elderly Norwegian folks in nursing homes. 33 of them died. And was this, the vaccine was just too much for them. And then you start with the notion that, every week in Norway, 45 frail Norwegian nursing home inhabitants die. So is this more than we would expect? No, it is not. They've examined the first cases. I think at least 15 of the people, there was nothing untoward. I'm not saying it's perfect because every single therapy we have has a potential. Aspirin, I've seen people die of overdoses of aspirin, of Tylenol, of vitamins. There's nothing that's entirely safe. But I think as things go, vaccines in general, and these vaccines in particular, so far seem to be very, very safe. I'd be interested to know what the rest of the panel wants to say about that.
Great points. Yeah, Dr. Rubin.
I couldn't add much more to Dr. Mason's thorough response. I mean, other than to say that there hasn't been uh, as far as I know, really clearly documented deaths related strictly to the vaccine. And you're right that vaccination manufacturers have a vested interest in saying that their vaccines are safe. However, it seems to be, just if I can take a lesson from how the clinical trials have been conducted, and when there has been any hint of there being an adverse reaction, an unsafe, a potentially lethal or serious reaction to the vaccine, they have pulled back on the trial and held back until those particular reactions have been investigated. So that gives me confidence that they really have all of our well-being at heart, despite I understand there is a mercenary component to the development of vaccines by these companies. But I have had my vaccine. I've had my 2 vaccine doses. I know many other people, and I really and I have not come across anybody that has had a serious reaction. And so I feel confident in its safety profile at this point.
Can I add one thing too, which is there's a mandated observation period after you get your shot. You come in for shot 1 and you have to go and sit down and be looked at for 15 minutes. If you have a history of allergies or allergic reactions, you have to sit there for 30 or 45 minutes, because in truth, most serious reactions occur within less than an hour. So there is a piece to this vaccine that's different than your flu shot, your tetanus shot, or a lot of the other kind of routine vaccinations that you've had in your adult life, or that you can think about your kids having had.
Yep. So, and just Dr. Odom, I was just going to ask you to chime in about how nurses help alleviate these type of fears, just like this patient may have had. And when people come in, how is that discussed with them, with the patients?
What we're doing is educating them about the vaccine, as Dr. Rubin and Dr. Mason said. We're letting them know that there are potential side effects for taking the vaccine. You see soreness in your arm, you may get a fever, you may get chills, but we have to realize that our body is also responding because we're creating antibodies to fight the virus. So it's not just that, the vaccine is making you sick, your body is getting prepared to help you fight the virus. So that's why you will see some of those reactions. So as a nurse, as a clinician, it is our job to educate you, to make you feel comfortable with getting that vaccine. I too have had both doses of the vaccine. My response was pain in my left arm, literally, and nothing else. But we have to remember that we are not just taking these vaccines for ourselves. We are taking it for each other. We are taking it to protect one another. We are in this fight together to eradicate this disease. Our frontline healthcare workers are sacrificing every day, fearlessly, tirelessly. We have to help them. If you get your vaccine, you're helping a nurse, you're helping a physical therapist, a respiratory therapist, a nurse aide, a unit secretary. I mean, they are fearful coming into work, but they still come because they're dedicated. So if they're willing to make this sacrifice, you guys need to make the sacrifice to say you can be brave enough and you can choose faith over fear and get this vaccine in order to help us fight this pandemic.
And that's great. And I just think it's so important that all of you are healthcare professionals. You're following the science. You're following the data. So next, I'd like to introduce Andrea. And she has some questions that were coming from the chat. So Andrea, go ahead with question 1. And if you guys could just answer the questions, we have a lot of questions we want to get through really quickly. So we might have to do rapid fire.
All right. Hi, can you hear me?
Yes.
Okay, great. Okay, I think one of the questions may have gotten answered earlier, but I'll just rephrase it. A lot of people have concerns about if they have allergies to things like penicillin or other drugs. What concerns should they have as far as that goes, allergies?
Dr. Rubin, do you want to take that one?
Sure. If you have allergies in general to other kinds of medication, it doesn't mean that you're at high risk to getting a reaction to the vaccine. However, if you have had reactions to other vaccinations, that's where we're most concerned. So if you have had swelling of your arms, certainly if you have had, hives or shortness of breath, or what we call anaphylaxis, where basically you collapse. after having other types of vaccines, then that is something to be of concern, and you should consult your own medical provider, your primary care provider, about that
Okay.
to see what the risks might be. Because what this might mean is you can get the vaccine, but it would be done in a more controlled situation.
Okay, thanks, Dr. Rubin. Andrea, what's the next question?
All right, so I have another question here. So they say they're insured in Illinois, but they live in Wisconsin. Does that have any bearing on where they need to go to get a vaccine? Can they come to their provider that's in Illinois?
Sure.
Yes. The answer to that is
Yes.
yes. Next question.
Okay, great. So what kind of observation will occur after you get vaccinated? So I know you said that there would be some time immediately after. Will there be any sort of observation happening, like maybe a couple days after, or in between getting the first and second shot?
Dr. Odom, do you want to take that one?
Yeah,
We kind of touched it.
they're in the clinic getting the vaccine, as Dr. Rubin said. We do monitor them for 15 minutes, up to 30 minutes, up to 45 minutes maybe. But after that, we are not following them into the community. If you have any issues, you need to follow up with your provider once you get the vaccine, if you present with any symptoms days later after receiving the vaccine.
Thank you. So we have a couple of calls on the phone. So let's go to our next phone caller.
Okay. As we move through the phases, is it guaranteed there will be enough vaccine for everyone in each phase to receive both doses on the recommended schedule?
Yeah.
And then,
Okay.
and if the availability of both is guaranteed, you wait until you know dose 2 will be available. And if you receive dose 1, but you don't get dose 2 on schedule, you kind of have to start over. Does that negate dose 1?
No, so go ahead, Dr. Rubin. Do you want to answer the process of the dosing schedule?
Sure. First of all, there are several other types of different manufacturers coming out with different types of vaccine for COVID-19. And so we do anticipate that there will be enough supply, maybe not only the Pfizer and Moderna, there's Johnson & Johnson and AstraZeneca, et cetera, and these will be rolling out over the succeeding months. And so we anticipate that throughout the next year, so that I think it's going to take to vaccinate everybody, that there will be enough vaccine. Also, if you, for whatever reason, don't get your second vaccine within the time period specified, 3 weeks out, 4 weeks out, whatever it may be, it doesn't mean you have to start all over again. Just get that second vaccine when you're able to get it.
Thank you. We have another question from a caller online. Go ahead.
Hi, I have 3 quick questions and I'm going to hang up.
Okay.
Which vaccine is it? Is it the Moderna or the Pfizer? Second, do we need to still wear a mask after we've had 2 doses? And could you be so kind to give the website again to go on Thursday? I'm going to hang up.
Thank you. I think, Dr. Rubin, you can answer those probably pretty fast.
Okay. First of all, the last question, the website, I would say just go to our website, which is cookcountypublichealth.org, cookcountypublichealth.org. And on Thursday, there will be the right link to click on for the newer website. If you want to go to the older one, it's on that website right now. In terms of the, what was the first part of the question? Oh, is it Moderna or Pfizer? It just depends what we get from the state. We can't pick or choose which one. You can't pick or choose which vaccine you want. Some weeks we get more Pfizer than we get Moderna, or the other way around. It's whatever the state is getting from the federal government. And at this point, those are the 2 vaccines that we're getting. And we're getting them in about equal amounts at this point.
And everyone is allocated the second dose no matter which one they're taking. So if you're getting Pfizer, you would be allocated the second Pfizer dose, Moderna allocated the second Moderna dose. Okay. So thank you. I think we have another question from a caller on the phone.
Can I just jump in on the mask thing?
Oh, yes, the mask.
It's really
Thank
critical.
you. Yes.
Yes.
Yeah, we all need to keep wearing our masks. I'm vaccinated. I'm going to be wearing a mask probably through the end of the year. There are people who are not vaccinated wearing masks is central to decreasing the rates of infection and the spread of infection. If we really want to do this, we need to keep wearing our masks. So please, it's a message that can't be said as emphatically and as clearly as anybody can say it. Wear your masks and wear them religiously, and make sure that your family and your friends are protected, because your mask protects them and their mask protects you.
Excellent point. We almost skipped that one. Thanks for catching that, Dr. Mason. Okay, so we do have another question from a caller on the phone. Go ahead, caller.
Good evening.
Go ahead. Good evening. Hi.
Thank you. I am in Group 1B, and I'm calling to find out how, with the city limits, can you register to get an appointment for a vaccine?
You mean the city of Chicago?
City of Chicago, within the city of Chicago.
Okay. Dr. Rubin, do you have any input?
Yeah, I think that the city of Chicago is doing things similarly to the suburbs, in that you cannot get online to register for an appointment directly. What you can do is go to the Chicago Department of Public Health website, and they will have information for you there. In fact, they have an app, because I live in the city of Chicago myself, and I got onto this site, and I signed up for my interest in getting the vaccine, saying I want to get a vaccine. They ask you how old you are, what your occupation is, what your address is. And then they send out a message. I've in fact already gotten one. You are in the 1A category. Please click this link, and this will get you to places that you can go to be vaccinated, or where you can set up an appointment. And obviously I didn't have to do that because I've already been vaccinated through my institution. But they keep track of what phase you are in, and then they push that information out to you.
Thank you. We do have another question from a caller. Go ahead, caller.
Yes. My question is, if the vaccine does not cure the COVID or prevent from spreading, what exactly does the vaccine does?
Okay, that's a good question. Dr. Rubin, you all could probably have input on this one.
Yeah. So I can start out. In most instances, 95% of the time in these vaccinations, between 90 and 95% of the time, they actually will prevent you from getting the COVID infection. But there might be some individuals where they may not actually prevent getting the infection, but when you will get it, it will be generally a very mild disease. What we don't know yet is there is so much COVID out there now circulating in the community that even 5% could be a large number. And so that's why we need to continue wearing masks and the physical distancing and not gathering in large groups to keep ourselves safe. But it doesn't mean that the vaccine doesn't prevent you from getting the disease. In most instances, it does.
It will keep you out of the hospital, which is very important. So make sure you're getting that vaccine, because it reduces the severity of COVID and keeps you out of the hospital.
And just to piggyback on all of this, remember, almost all viral diseases don't have a medicine to cure them. Bacteria, which are a different kind of infection, have antibiotics. So we have penicillin and tetracycline and, whatever. We have all these good things. But for viruses, vaccines are our major way of keeping people safe and healthy. And little babies get vaccinated for measles, mumps, rubella, chickenpox. But us adults have a whole schedule of vaccines we're supposed to be getting. And I suspect COVID will become part of our routine vaccine schedule to prevent us from being ill.
Yes, well, thank you. These are excellent questions. They keep coming in. We also have some more questions in the chat. I think that Andrea can go ahead and ask those questions. Andrea, what's the next one?
Yes. Yeah. Okay. So let's say somebody has an appointment to take a vaccine. They don't show up, so they have this extra dose. Is there any sort of protocol that they have for making sure that they're able to use all these doses if somebody doesn't show up?
I'm sure Dr. Rubin has an answer.
Yeah, I mean, in most institutions, whether it's a large clinical site or in a hospital, they have a way of reaching out very quickly to individuals that might be near enough by that they can come in and they can get that dose within a couple of hours or so that it won't spoil. And so far, our experience has been in getting information in from our sister hospitals throughout the jurisdiction. There are 15 suburban hospitals, is that as far as I know, there has been almost no wastage whatsoever. Maybe, just very few doses where maybe something was dropped, or where they just couldn't get it into the arms by the end of the day. But it's like negligible. I mean, really under 20 doses, for example. There's been almost no wastage whatsoever.
So one thing I want to add for full disclosure is we really don't know how long lasting the immunity from the vaccine will be for COVID vaccines. We hope it will be a lot like tetanus or HPV, a vaccine that kids are getting, but it could end up being like the flu, where we get a new vaccine based on variant. I doubt it very much based on the signs we're seeing for the virus, because it doesn't mutate quite in that the same way that influenza virus does. But people need to bear in mind that the studies we have tell us about immunity out to a certain period. And interestingly enough, this point should be made very clearly. It turns out that immunity from a COVID vaccine is probably better than the immunity that you get from having the disease.
Great. All right. Andrea, I think you have another question for us.
Yes, I have another question. So here's a quick one. Let's say if the vaccine gets left out and it kind of loses its potency, if you get that vaccine, will it still produce antibodies even though it's not as potent?
It might produce somewhat of a response, but if it's left out too long, the instructions are to discard it and not to use it.
So the hospitals follow these guidelines, and so that probably doesn't happen that often, right, Dr. Rubin?
Correct, almost never.
Okay. Andrea, any other question?
Yeah, I got this other question. They're asking, let's say you have like maybe a small group of people, either like your family, close friends, or maybe people in an office. If they're all vaccinated, do you still need to wear a mask?
Yes.
Yes.
You are still going out in public. The vaccine doesn't necessarily mean you're not going to get COVID. And as Dr. Rubin and Dr. Mason said, you may not have symptoms. You may be asymptomatic. So you need to make sure that you're still wearing the mask, even if you've all been vaccinated. It's very important.
Because you can still transmit the virus. Spread the virus. Yes.
In fact, about 25% of cases are from asymptomatic transmitters.
Without being vaccinated.
Right?
Yeah. Dr. Rubin, did you want to add anything to that?
I think that says it.
Okay. All right.
Clearly. Yeah.
All right. Well, we have another question from a caller on the phone. Go ahead. On the phone, please.
Hello.
Hi.
Hi. Thank you for taking my call. So my question is this. I am relatively young. I'm in my mid-30s, and I'm healthy. So based upon everything that I've seen and read, I would essentially go last to get vaccinated. And I kind of wanted to know how long everybody thinks that may take, because it feels like, at least kind of watching the rollout so far, that it'll be December before we get our turn. And I obviously understand that people who are more vulnerable, but
I don't think it's going to be
really
December.
Sure.
No, it's a very good question. I mean, I have a 20-year-old, so I want her vaccinated, and she's a college student. So I definitely want her vaccinated so she can go back to campus. But that being said, I don't think it's going to be December. It might be summer, sometime in late summer, maybe early fall.
We have to realize that there are new vaccines coming on the market regularly. So there's going to be more vaccine available. So they are looking at late spring, early summer, and trying to roll it out to the general public.
Including vaccines that don't require cold storage. And that's going to be really important for your smaller places, your more, I don't mean smaller, but like little, but rural places and little tiny clinics that only see a few people. To have a vaccine that can keep at room temperature, when that comes on the market, that's going to be a great advantage.
And also the Johnson & Johnson that's coming up fairly soon is only one dose. So even better. So we one dose and only refrigerated. Yep.
Lots of options. And then we also have the Biden-Harris administration promising a mass vaccination rollout plan for 100 days, which is going to actually help if it can happen that way. So next we have a question from Andrea. Do you have another one?
Yeah, so I have this one here asking if there's any study showing the efficacy against the new variant, the one that came from the UK, or I guess any variants for that matter.
There's 2 new variants. People tend not to know about the second one. One can speculate why that is. It's been found in South Africa, and people tend to neglect that part of the world. And there's a new variant from South Africa as well as the one in the UK. And the one in the UK has now shown up in the United States, in Indiana, and also probably Illinois. And the vaccine, as far as we can tell, knowing how the vaccine works and what it targets in the cells, is that it will be effective against these variants.
But they are testing it. I mean, this is not something that's being neglected. But as Dr. Rubin said, the vaccine is against those things that stick out of the virus, those little spikes that make it a coronavirus, which lock into the membrane of your own cell. And it's not an area of the virus that mutates enough. So if it mutated enough, it wouldn't be able to attach to cells, basically. So it seems like pretty good science, this area of the virus to have a vaccine against without worrying that much.
When we brought up the subject of Africa, Donna, do you mind if we talk about race and the vaccine? I think it's a good time to address this. So
I think it's a good point, especially since we know the disproportionate numbers that have occurred in Black and Brown communities. And your hospital is located right in the mix of it.
On the south side of Chicago. And so people are asking, as African Americans, why they should get the vaccine. And my answer is simple. It's healthcare disparities.
Okay.
If an African American person contracts COVID, they are more likely to die from COVID when compared to other ethnicities.
Okay.
The issue is exacerbated by socioeconomic status, pre-existing health conditions. In addition, most people of color are essential workers on the front line. And so this makes it imperative that we consider getting the vaccine. Yes, we have a history of Tuskegee. We have a history of mistrust. But I need us to move past that so that we can have healthy community and healthy lives. We have to put ourselves in this fight to stay alive, to make it better for our community. And the only way we can do that is to sign up and get this vaccine. So yes, we have fear, but I'm asking you to please choose faith over fear. Use me as an example. I am a woman of color. I am a 50-plus-year-old woman of color wanting to save my community in a community hospital, working side by side with people who are sacrificing for our communities. But we have to do our part. You want us to sacrifice? Do your part. Give us something to fight with. Give us the ammunition we need to keep fighting. Show us that you're there with us to help us. It's hard. It's challenging. My leader, Dr. Rashard, I want to call him Dr. But Rashard Johnson, he had fear of getting that vaccine. He did not want it. We talked over and over about it. He said, I'm not getting it. And then he decided to do it. He led the charge. I joined him in the charge. The rest of our leadership team is signing up to join in the charge. If we're in the community servicing you, willing to put our lives on the line, sign up and get the vaccine. Sign up. Sign up. Go to McDonald's. Wait, one more thing. Go to McDonald's and you eat those French fries. What's in those French fries? If you leave them on the counter for 15 years, they'll still look the same, but you still choose to eat it. But you won't get the vaccine. Help me understand that. I tried to make sense out of it and I cannot. We have to stand up and do our part. We are not victims. We are victorious. We are victorious people. So be courageous. Show that victorious spirit and get the vaccine, please.
Yes, well, thank you. And I also want Dr. Rubin to chime in because I know Cook County has an equity component to the vaccination plan and why that's important. If you could just say that quickly, because we're about to wrap it up here.
Sure. I'm not so sure how I can follow that impassioned, appropriate response from Dr. Odom. Thank you so much for those words.
Okay.
What we're trying to do in our health department, also the city's health department, most health departments, is that equity and looking at racism and disparities, we build into every single thing that we do. And in terms of vaccination, what this means is looking at what we need to do in order to get our Black and Brown communities vaccinated, to make sure that they're prioritized, to make sure that they understand that we're doing everything that we can to answer any one of your questions, to help you deal with any of your fears or concerns that are well-founded, so that we can make you understand how important it is that it saves lives. This vaccination saves lives for you and your families and your communities. So we're working as one of our initiatives is to set up vaccinations in communities where you don't have transportation, where you don't have a local pharmacy where you can go. There isn't a Walgreens there in your community. There isn't a community health center that's giving out vaccines. So we want to make it available and accessible to you. We want to work with you and to get your questions and your concerns on the table so that we can address those. And we have a whole equity program built into our vaccination and our whole COVID response that's trying to address these problems and issues on a daily basis.
Thank you, Dr. Rubin. We just have time for one more question from a caller that is on the phone. So can we take that caller?
Hello?
Hello, hi.
Yeah, hi. I just had two quick things that I just heard y'all say. So the first thing was I heard about the South African variant, and I heard it's a lot more dangerous than the UK or the one that's here. And I wanted to know, one, if that was true, and two, why that's true. The other thing I wanted to ask was, how do you know if someone gets vaccinated? Like, I work with the public, but we don't make people like show proof that they've been vaccinated. So when someone tells me like they have been vaccinated, how can I know that they're being honest?
Yeah.
Well, first of all, about the South African variant, we don't know yet whether it is more virulent, so causes more serious illness than the current strain. What we do know, like the UK strain, is that it's more easily passed on. It's more contagious. And time will tell, it might end up being a more virulent or more dangerous strain. We don't know that quite yet, because we also know that South Africa doesn't have the same resources, even though it has more resources than many other countries in sub-Saharan Africa. It also doesn't have the same amount of resources as, say, Europe or even the United States in terms of pushing out widespread testing, being able to maintain the physical distancing and the masking, etc. And so we don't know yet whether it's really more virulent and more en masse. And then the second part of the question, which was
how would you know if someone has?
Oh, how would you know? You get a vaccination card. And they're not yellow the way they used to be when you get a travel vaccination card. They are white. And I don't have mine with me. It's downstairs in my wallet. You have a vaccination card. And frankly, if you're in a workplace, for example, or you're going to travel, and in order to get on that airplane, they require proof of vaccine, it's that card that will give you the proof. And it's not asking for a picture ID. It's just asking for the card. And on the card, it lists your vaccine, the date you have it, the lot of vaccine, the type of vaccine. And it has your first dose and your second dose on it. So that card is your proof. In addition, every single person that's vaccinated, their information is put into the state database that's called iCare, which is the Illinois Vaccination Registry. That's how I know if my daughter got all of her vaccines, I can talk to her doctor who can query the iCare system, and it lists all the vaccines. So there is a public health database that keeps track of whether you've been vaccinated.
Well, thank you. You know, this comes to the end of our question and answer session. I want to thank CAN TV, first of all. If there's any additional information or you want to see this again, you can go to cantv.org. And I just want to thank all of our wonderful speakers for all the valuable information. You see, there's a lot of people who had questions, and we did get them answered, I believe. So Dr. Rubin, thank you. Dr. Mason and Dr. Odom. You have been an excellent panel tonight, and it's just so important that we provide information because it's always changing. And I also want to thank Women to Win as well as Chicago Women Take Action for putting this program together tonight so that we can bring information to the community and that we can also educate and provide resources when needed. So that concludes the program for tonight. Good night, everyone, and have a great evening.
Good night. Thank you.